full sleep clothing in such hot and humid temperature, with a cold, frigid look, and the child appeared malnourished. Since the child had a number of hospital visits, you can get certain weight and height of the child as per his age, and on plotting them, we can see that there is a sharp decrease in both the weight and the height, thus claiming that the child might also have a feature of phreatic height. For the physical examination, beginning from the top, we could see that there was thin scalp hair along with patches of hair loss. There were missing teeth, penny-shaped bruises under the neck folds. Going down, you could see that there were multiple bruises of different ages. And an examination of the limbs, we saw that the child was using the left upper limb very little. Along with there were few circular wounds on back of both the hands. On examination of buttocks and genitalia, there was patulous anal opening along with few bruises around the genitals. For the investigations, we started off with sending relevant blood, urine, and stool investigations, which came as within the normal range. With a suspect of history and examination, we also sent for some toxicological analysis. Since the child presented to us with minimal use of the left upper limb, we decided to go for a plain X-ray of that limb. Here we can see that there is a fracture involving the lateral condyle of the left humerus. Along with that, there is a linear fracture over the lower portion of the left radius. So, getting such mixed match history, examination, and lab investigations, can it be a different case, like apart from what we normally see in the OPDs or the emergencies? So, coming to the topic proper, child abuse. A child is considered as a person below 18 years for all practical purposes. Child abuse is defined as a variety of abnormal behaviors directed against children. It comprises of all forms of physical, emotional ill treatment, sexual abuse, negligent treatment, or commercial exploitation. What are the forms of child abuse? It can be due to neglect, physical abuse, emotional, medical, or sexual. Starting off with each topic, child neglect. Neglect refers to a range of circumstances in which a parent or caregiver fails to adequately provide for a child's needs. Certain types, physical neglect. Here the caregiver fails to provide the basic amenities to the child like clothing, food, shelter, and personal hygiene. For the supervisory neglect, it refers to when a caregiver fails to provide adequate supervision, thus landing up the child in some emotional or violent conditions. For emotional child neglect, it refers when a caregiver fails to provide certain love, affection to the child as and when needed. Nutrition neglect refers when the parent is unable to provide adequate nutrition, thus the child gets landed up into undernutrition, or the caregiver fails to prevent overnutrition, thus the child can have certain medical risks and causes too. For the medical neglect, it refers when a caregiver fails to seek or get proper medical care as and when needed by the child. For educational child neglect, it is referred to when there's failure from the caregiver to enroll the child or get him homeschooled, or when the child cannot get prompt attendance in the school because of the neglect of the caregiver. The signs of neglect in the child can be seen as the child is unhappy, aggressive, hungry, weak, with a poor personal hygiene. Coming to physical abuse, it is described as excessive intentional physical injury to a child or excessive corporal punishment of a child. What are the red flags that we can find in a suspected case of physical abuse? Implausible history. The history as given by the caregiver or the parents does not match with the present condition as which the child has been brought up to. There is unexplained or excessive delay in seeking care, or the severe injury is explained as self-inflicted or blamed on other young children or pets. What are the characteristics which you find in parents of a child who are physically abused? The parents seem to be emotionally impaired. There might have been a history of substance abuse. There's a lack of social support, history of domestic violence, or there might be a history of childhood abuse in the parents themselves. These child, during the course of their childhood, they find it difficult relating to the peers and are often vulnerable to emotional storms. They are not quite oriented, or they're not capable of taking, making themselves oriented in scenarios of certain crisis, thus landing up into panic attacks or anxiety. This is a slide showing bruising patterns which can occur from certain instruments that a perpetrator might use for childhood abuse. Emotional abuse. It is a condition in which children do not get adequate attention from the parents or guardians, or are not given approval or acceptance. They may be constantly criticized, blamed, sworn and shouted at, told that other people are better than them, or rejected by those they look up to for affection. Sexual abuse. It is an incident wherein an adult engages a minor in a sexual act or exposes the minor to inappropriate sexual behavior or material. It is also described as any incident in which a child is coerced into sexual activity by another child. Certain signs that can be seen in those children: they are withdrawn, unhappy, with suicidal behavior. They can have aggressive and violent behavior with frequent mood swings. They can appear detached. They can complain of pains for no medical reason. There can be some eating problems, or they can come with sexual behavior, language, and knowledge which is too advanced for their age. Coming to medical abuse or Munchausen syndrome by proxy, it refers to as a child receiving unnecessary and harmful or potentially harmful medical care due to a caregiver's overt actions, including exaggeration of symptoms or lying about the history, or simulating physical findings, or intentionally inducing illness in the child. For example, a caregiver might say he can describe a single episode of regurgitation as multiple bouts of vomiting, and we can see that the child is faithful, not dehydrated, but the caregiver gives otherwise history. For inducing illness in the child, the abuser can use certain things like using ipecac to induce vomiting, or using stool softeners to mimic diarrhea. Signs of medical abuse. The illness is often recurrent, unexplained, unusual, or prolonged, and does not respond to treatment as expected. The child is subjected to a large number of healthcare without improvement. The signs or symptoms occur only in the presence of a caregiver. And in children with induced or fabricated illness, clinical improvement often occurs when they are separated from the caregiver. So I guess by now, we might have come across one or two cases in which you see that the parents or the caregivers coming with a child with a huge pile of medical history. And while going through the history, we can see that many a times the child has been stamped as functional disorder or some form of like somatoform disorder. So are we to allowed to stamp the child as a functional disorder, or should we look into some other possibilities as well? So here comes the role of differential diagnosis. For example, when you see a bruise, it can be due to some other medical disorders like some bleeding disorder, vitamin K deficiency, salicylate ingestion, immunoglobulin A vasculitis, dermal melanosis, or hemangiomas. It can also occur in the case of non-abusive traumatic bruising in healthy children, where the most common locations of unintentional bruises can be seen over scalp, knee, shin, or thigh in mobile infants and children. Uh, these are the locations which are exposed in a locomotor kit. In case of fractures, it can be due to non-abusive trauma, or it can occur due to some medical conditions like osteogenesis imperfecta, pathologic fracture due to osteopenia, congenital insensitivity to pain, or these fractures can occur from certain metabolic bone diseases, for example, vitamin D deficiency. For the coming to the differentials of burns, first is phytophotodermatitis. It is a burn-like lesion which occurs when a skin is exposed with certain plant products. The plants being lime, garlic, chrysanthemum, eder, etc. It can also occur, the burns can also mimic certain chemical inherited burns, which can occur due to senna-based laxative causing perianal burning, mimicking diaper rash. Coming to the differential of impetigo, which can mimic as secret burns. We see two pictures over here. The right hand side, when impetigo occurs, it is a bacterial infection caused by Staphylococcus and Streptococcus, which usually involve the superficial layers of the skin. Instead, secret burns causes deeper wound infection. So, how should we approach when a child is brought to us with a suspected abusive case? First, we have to take a history. First, we will take the history from the caregiver. Along with that, next history will be taken up from the child. We have to separate the child, build a good rapport with him, make him comfortable, and avoid bribing or coercing him with giving gifts so as to like take out answers from him. We have to avoid uh, naming some persons or some scenarios which might be uh, along with that, we have to ask 3W questions, which is who did that to you, when did it happen, and what did it do to you? After the child is after the child is like made comfortable, then we can go on for the general physical examination. Firstly, we have to look for the appearance of the kid. Usually, it's expressionless. The child doesn't doesn't like look at you when they're being questioned. Going for the examination, we have to start from the top. We have to look at any scalp injuries, any bruises, any lacerations that can occur in the hidden areas of the neck folds or the axilla. We also have to examine the eyes for any hemorrhages. We have to examine the ear for any uh, trauma or tympanic membrane rupture. On examination of the trunk and limbs, we have to look for bruises, some pattern bruises, burns, and fractures which can occur the ribs or the limbs. We also have to examine the genitalia. For example, in a previous case, we saw that the child had patented anal opening. This can happen in a case of sexual abuse, or it can also occur in a case of chronic constipation. If a child is coming to us with pain over certain areas of his body, we have to go on and search for some visceral injuries there or not. Next, coming for the investigations, we can send some routine blood investigations. Along with that, we have to send for a coagulation profile when suspecting a case of bleeding diaphysis. Along with when there's a suspected case of some fractures, we have to send for a bone profile to differentiate it from other medical conditions. For the radiological purposes, we can start it with a pain X-ray, then proceed it with skeletal survey as and when needed. We can also do bone scans. Ophthalmological examination can be done. USG whole abdomen is to be done in a case of visceral injury, and CT scan and MRI as and when needed. This is a bone scan which shows multiple posterior rib fractures. In case of inflicted rib fracture, there are sequential ribs are involved, which corresponds to the abuser's fingers. On ophthalmological examination, we can see certain retinal hemorrhages which occurs in a case of abusive head trauma. Secondly, we have to go for psychosocial assessment, in which we have to see what is the condition of the family, what are the finances, how is the how is the caregiver's coping skill, and is there any history of substance abuse or childhood abuse in the caregiver himself. Now, coming to the management part, first we have to stabilize the kid. We have to identify any injuries that require urgent uh, attendance. Secondly, we have to report and document any suspected abuse case. Thirdly, we have to dispose of thirdly, disposition, which refers to we have to look for if any intracranial or intra-abdominal trauma is there, or like the person is infected with burns over a like large surface area. We have to refer the kid as and when needed to the traumatic center. More than important, we also have to identify injuries in other children who are at risk in the similar household. These are some laws pertaining to in a case of suspected child abuse. Firstly, there is Child Welfare Committee. Then comes the POCSO, or the Protection of Children from Sexual Offences Act, Child Helpline, which can be reached at 1098, and the Juvenile Justice Act of 2015. The POCSO Act, it was implemented in the year 2012 in the month of November, and it is an act which safeguards a kid from the harassment of any sexual abuse or sexual harassment. Certain amendments that were made in the year of 2019, it was to increase the period of punishment in a case of sexual abuse from 7 years to 10 years. Secondly, it added to the definition of aggravated penetrative sexual assault as when a child dies due to any sexual assault, or when a sexual assault occurs during natural calamity. So summing up, I can say that the objective of my today's presentation was to make us aware that childhood abuse, which is a very important sector, is often missed, and the childhood protection is not something that should be a burden to pediatricians. In fact, it should be a satisfying area of clinical practice with a good and measurable outcome for a child.